Welcome, everyone. Thank you for tuning in. I am Brenda Lormill. I serve as the equity nurse practitioner for the Tamir Center at the Massachusetts General Hospital Cancer Center. I'm also the executive director of the Haitian American Medical Association, a nonprofit based out of Boston where we do a lot of culturally sensitive health education for our Haitian American communities and also provide academic scholarship for our wonderful Haitian American residents of Boston, Rhode Island, and New Hampshire that are pursuing a degree in healthcare. Love the ways that we can support our community. But outside of being in the community, you can find me at MGH in the Phase 1 Research Center, which is also known as the Tamir Center, like I had said before. But also at MGH, I have the honor of serving as the equity nurse practitioner, being involved in various different equity related projects across the Cancer Center, one of which I have the honor and pleasure of talking about today with one of my favorite people, Dr. Colin Weeks, who is joining us on screen. I can introduce Dr. Weeks, but I know sometimes I can butcher introductions. So Dr. Weeks, please introduce yourself to all of our wonderful audience that may be tuning in right now.
Thank you, Brenda. It's a pleasure to be here. As Brenda said, I'm Dr. Colin Weeks. I'm a medical oncologist focused on GI cancers at MGH Cancer Center, where I direct the pancreas cancer research program and also have a role in focusing on cancer equity and have been working diligently over the last year to develop the Cancer Equity Colloquium along with Brenda. And so I think that's what we'll talk a little bit about today.
Thank you so much, Colin. Um, you talk about over a year. I'm going to correct you there. I think it was beyond a year because prior to this year, which is the second year that we are doing this conference actually started last year in 2022. It was a virtual conference and it was a very successful conference. Can you just tell us a little bit about the outcome of the 2022 Equity Colloquium as we build up to 2023?
Sure. So the whole premise of the colloquium is to try to provide a venue where individuals from the community can engage both our academicians, healthcare providers, as well as the general business sector to sort of come together to think about novel approaches to approach issues that underlie cancer inequity. And so last year it was a virtual meeting, and the speakers were comprised of academicians doing various things, individuals in the community, and really was, I think, had a very sort of familial tenor. And I think it was very well received. And for me, it was a joy to participate in. And I'm really looking forward to this year, which will be sort of a hybrid meeting in which we'll be joining everyone at the Marriott in Cambridge, in addition to having a virtual component of the meeting as well.
I love it. I'm so glad you stopped right there because I was going to back us up a little bit to 2022. I agree. I enjoyed being there as well, co-leading it with you, Colin. And the great thing about evaluations is you could actually figure out what people are thinking after your event is over. And the evaluations were amazing. And I'm not just saying that because, of course, we were both leading this conference in addition to our program manager Elizabeth Brooks, but also to speak to the feedback. And there were many comments, but the one paragraph that I just kept reading over was a feedback from a resident from Brazil who joined us virtually. There were other folks from outside of Boston who were tapped in virtually and there and engaged, which was very rewarding to see that the work that we're doing is not only impacting folks who are in Massachusetts or Boston, but the virtual component allowed us to have a reach that was deeper than what we expected, which was pretty cool. And then now moving into 2023, we have folks registering from outside of Massachusetts again, some international folks again, which is nice. So now that we're at 2023 and we completed 2022, what is the one thing I would say that you're looking forward to this year?
Yeah, I think the most important thing I'm looking forward to is us being in person, right? It's being able to rub shoulders and talk and smile and laugh and really communicate in a really tangible way. So I'm so excited about this year being an in person event, and we have a large number of registrants who are really representing the entire target audience that we were trying to achieve. So community members, academicians, healthcare providers, as well as members of the business sector. So I think it's going to be a rich conversation over the 2 days of the symposium.
I couldn't agree with you. I think virtual was cool last year because we were restricted for, COVID COVID
Yeah,
restrictions. We have to follow the rules for sure. But being in person is going to be pretty amazing this year. I think, having the opportunity to engage with the community leaders that are going to be present, and individuals from the community that are going to be present who are so thrilled to be in the space with the folks who are leading the cancer centers, with the clinician who are taking care of cancer patients who may be, someone who they know, a loved one that they have that has been impacted by cancer. Having those conversations with folks who don't always find themselves at conferences like this, that is a piece that I am more and more thrilled. I'm thrilled about it. I can't wait to see folks. I look forward to the learning and the sharing of information and also the networking, right? There are
yeah,
going to be students in the room. The networking is going to be amazing. So, we're obviously telling you all of this, those of you who are watching, to invite you to come. But I think it's important for us to tell you a little bit more details of when it's happening and where. Dr. Weeks told you it's going to happen in Cambridge at the Marriott in Kendall Square. The dates are Friday, April 21st and April 22nd. We have the conference, the format of the conference will have solo presenters, we'll have panelists, various different panel discussions. And you can find more details on the conference website, which was provided below. Feel free to reach out and look through the agenda to see who the speakers are, what we'll be talking about over the course of Friday and Saturday, April 21st and 22nd. But then on Friday night, after we have our first day of learning, sharing, networking, we're going to continue that networking, sharing, and rubbing of shoulders, like Dr. Week said, at our welcome reception at Artists for Humanity in Boston. We thank their team for hosting us this year. We're going to have an amazing time there where we're going to have a highlighted expo of cancer patients, cancer survivors, modeling designer brands of Black and Brown owned companies out of Boston, and really just coming into the fold of our audience and sharing their cancer stories. We're going to have a DJ. There's going to be a lot of good things happening Friday night. Now, sometimes when I talk about Friday night, my colleagues tell me to be careful because it seems like I'm promoting the reception over the conference. And that is not true. I'm just really excited about it because that's where our community is really going to they're going to come together and they're going to be there. We have local makeup artists and hairstylists who have donated their time to be there with us. So I'm excited about all of it, but I think I'm a little bit biased about the reception because that's the heart of it. That's community for sure. So anything you want folks to know, Colin? Anything you want to say to those who are watching?
yeah. I think the beauty of this meeting, from my perspective, is that all of the faculty members, whether that be sort of academicians like myself or members of the community, um, uh, they've all decided to be there for the 2 days of the event, and so people are going to have unique access to these individuals. I think so often when you go to a conference, you'll see the speaker on the stage, and then once they're on off the stage, you no longer get to access them. And so, what's going to be unique about this meeting is that they're all going to be there for the 2 days of the symposium, and everyone has devoted their time so that they can, um, meet the registrants and really engage. Our keynote speaker is going to be Dr. Karen Winkfield, who is leading an effort to bridge Meharry's Medical Center with Vanderbilt's Medical Center and really sort of come together and sort of try to bring the traditionally uh, academic centers with a medical center HBCU. And so she's really has a unique perspective on this issue of cancer equity and what goes into addressing issues that underlie that. So I'm really excited to host Karen. Amongst others, we've got cancer center directors who are going to be talking about sort of the role of cancer centers such as MGH and how they can do better in terms of engaging the community. Brenda's done incredible work to develop a panel of faith-based leaders who will be talking about sort of their roles in the cancer diaspora. So really, I think a really unique and enriching environment.
There's something for everyone.
Exactly.
To summarize, there is something for everyone. So we hope to see you. If we can't see you in person, and I'm going to use the term again, rub shoulders with you, we hope that you would join us online. And maybe in future dates, you can join us in person. Whichever way possible, we invite you to be there. And then the most important thing, it is a free conference. The conference is free. If you are a healthcare provider and you're looking to acquire CEUs, there is a registration fee on our website. But if you are a healthcare provider and you just want to be in this space, you want to learn more, whether your background is oncology or not, whatever it may be, if you're a clinician, you want to be there, join us. If you're a researcher, you want to be there, join us. If you're a member from the community and you want to be present, whether you've been affected by cancer directly or indirectly or not, join us. Join us. We invite you to join us on April 21st and 22nd. If you have any questions, you can feel free to reach out to our program manager, Elizabeth Brooks, and her information is on our website, on the event website. So, Colin, it's always a
Yes,
pleasure
ma'am.
working with you.
Yeah.
It's always a pleasure chatting. I enjoy this work. I enjoy the work that's been going on for over a year,
Yes.
if I stand
Yeah.
corrected, over a year. And
Right.
I look forward to just see what this is going to be. I know it's going to be good. So it's going to be good.
Yeah.
So thank you
Very,
for your
very
leadership.
excited. Yeah. So I'm very, very excited. It's really great to work with you, and I think this symposium is going to be a blend of our mutual talents. So I'm excited to see how that comes together, and I'm looking forward to meeting everyone and having some fun in those 2 days.
Yeah, we're going to have fun. We're going to learn, and we're going to rub shoulders. Thank you, Colin. Thank you, everyone, for tuning in. We hope to see you on April 21st and the 22nd. Take care.